Finally, we got the FDA approval for the TIL therapy. The product is called lifileucel, and this is the first tumor infiltrative lymphocyte therapy to be approved for people with metastatic melanoma that they failed immunotherapy, or they failed immunotherapy and targeted therapy for the patients with the melanoma that harbors the BRAF mutation. So let's give you just a quick. First of all, the FDA approved it February 16. So the approval is real, and the company is called Iovance Therapeutics, and the product is called lifileucel. So what is TIL therapy? So basically, the TIL therapy requires removal of part of the melanoma. It should be at least 1.5 centimeter. It can be removed surgically. It will be sent centrally to this company, and this company can extract the lymphocytes or the tumor, what we call the T cells. Your immune cells, we got extracted, and those immune cells are unique to your tumor, so they got extracted, they grow in the lab, and then they reintroduce them or reinfuse them to the patient. The objective response rate is 31.5%, and that is absolutely impressive after somebody who failed immunotherapy and failed targeted therapy. We didn't have anything in this space. I think this approval will fill an area of unmet need. It is extremely exciting, and we can't wait to start treating our people with this product. So let me step back a little bit and tell you, how do we treat stage 4 melanoma? I mean, as you know, stage 4 melanoma right now, the first line agent is dual immunotherapy. This is most of the physician and clinician use. It's the ipilimumab, nivolumab. If they fail ipilimumab, nivolumab, then we go to the second line right now, Opdualag. That's kind of like the practice has been. And for people, if they fail Opdualag, for people whose melanoma harbors the BRAF mutation, they can take one of the target therapy. We have 3 combination target therapy on the market. So we move to kind of target therapy. But what if the patient with a wild-type melanoma, meaning the melanoma that doesn't harbor the BRAF mutation, what if they went through immunotherapy, Ipi-Nivo, and went through Opdualag? Now what? So it's going to be either a clinical trial, but now with this FDA approval, I think it's TIL therapy. So hopefully the patients will have a good performance status, because the toxicity from IL-2 is real. So people needs to be screened, make sure that they are really fit for this treatment. They're going to be able to handle the IL-2, and most of the toxicity in the clinical trial or using the TIL therapy stems from the IL-2 therapy. So it is really exciting. The responses are really decent. 31.5 objective response rate is impressive in this space. Something we have not had before, and their responses are durable. That's the nice thing about it, and it's a one-time treatment. You don't have to do it like every 3 weeks or every 4 weeks. It's just one-time treatment, and with decent responses and durable responses. So that's really, really exciting.